We at American Pharma Remedies welcome Dr. Henna Day, psychotherapist, to speak about health on the occasion of World Health Day on April 7th, celebrated worldwide.
Thank you for welcoming me on such a occasion as World Health Day, Pariha. And I'm very happy to be here talking about health. Health that is we have come to value more in last 1 year, especially in this pandemic. As we all know, the whole world is facing. The whole world may be celebrating this day, but the whole world has come in realization of the health and the importance of health, from lower class to the higher class, from people with luxury, money, to people with no money. Everyone has come in realization how important and how priority our health should be and what we should do about health. So talking about health, health is very important to us. Is very easy to say. How do we say we have a good health? It depends on our day-to-day functioning. As long as our day-to-day routine is not hampered by any ailment, any physical problem like aches or anything, as long as it is not hampering, it's a good health. Your mental health is directly connected to your physical health. How we think is how we feel. If you think right, if you're able to process your thoughts in the right way, your day-to-day function is also going to be right. The decisions that you'll be able to take is right. Your activities are going to go progressively correct. COVID-19 has affected each one of us. For the first time, the whole world has come together to fight this COVID-19. It has affected us, especially when we get the positive results. Every time an individual gets tested and he comes to know there is a positive result, the first thing that hits his mind is, I'm going to be quarantined for 14 days. And what I'm going to do for 14 days? You know, we are social animals. Not everyone has the luxury of having a good personal space to be quarantined. And of course, the whole family is affected. Everyone nearby and near dear one is affected. That is one thing. The second thing is all the medications that we take. We don't know the repercussions and the after effects. A lot of patients that I know are still being affected by the steroids and the after effects of other medicines. We have to be conscious, and we should be precautious. Of course, it is known fact that this goes, it is through the respiratory system that we are passing this on, right? So mask is mandatory no matter what. Social distancing is extremely important, and hygiene. So the 14 days can be spent very constructively, and it is your choice how you want to do it. There are many, we can make a bucket list, and all the procrastinated things that we've been working on, like learning a new language, picking up a new game, reading one of the books that we've been meaning to read but we haven't done it, or calling up your old school friends, checking out what they're doing, probably not doing so well yet. You basically spread out in different ways, and your day goes by really fast. But of course, most important thing that I advise everyone is meditation and breathing exercise of yoga. So meditation is the must early morning and the rest of the day. There are many meditation clips available on YouTube, like Deepak Chopra's or Patanjali's Vipassana. And these clips are not more than 10 to 15 minutes, and they give amazing results in calming down, in helping in anxiety. Basically, you start your day well on a positive note. So meditation is something I definitely advise each one of us during COVID and off COVID. So coming to mental health of Indian women. In India, going to a therapist, going to a psychologist, going to even psychiatrist is still considered as a taboo. Iska dimag kharab hoga is the thing that comes. Like literally being mad, literally something seriously wrong with your brains. That is such a myth. It's such a misconception. Going to a therapist, going to a psychologist, going to a psychiatrist means you're looking for a better quality of life. It doesn't mean that you have any problem. Now the things have been changing in recent times, where women are coming forward and they are looking for, they are in every field, talking from being a pilot to a doctor to a Marines, everywhere, sailors, everywhere, even NASA. So women are coming forward and they are accepting the idea of going to a therapist or a counselor in order to solve their small issues or getting a better balance between their life. Self-love is same as self-worth, self-value. I remember a good quote on self-love is, if you value yourself, or rather it came up to, if you don't value yourself, you are always going to attract people who don't value you either. Self-value is very important. Self-love, self-value, we can name different terms for the same thing. And how do we build it up? I get this question all the time. I have grown up with this thought in my mind about myself, with certain complexes. So how do I build my self-worth? Well, the quick way I can say is learn to say no. Saying no means saying yes to yourself. Learn to say yes to yourself. 2, you are a unique person. You don't need to be like others. Stop comparing. 3, make mistakes. You will make mistakes because you're doing something. If you don't do anything, you'll not make mistakes. And you'll never learn. So allow yourself to make mistakes. 4th, most important, giving time to yourself, giving space to yourself, taking care of your health, taking care of the people around you whom you worth, because it speaks about you. If you value people around you who has meaning attached to you, your spouse, your family, your siblings, say something about you. And one more thing, self-love and compassion go hand in hand. This World Health Day is a reminder to us to take care of our health, physical, mental, to be sensitive and compassionate towards the people around us, to be patient with the family members, with the animals, birds, environment, everything. Let us make our health our priority. If you love yourself, your health will be the priority.